A new video is being produced as part of our upcoming media kit and campaign, social media presence, and new members' invitation efforts, accompanying the launch of the new website. This is coordinated through the newly established Communications Working Group, which is set to keep on building and maintain the full communications infrastructure of the action, under the highest standards of open science and pedagogy, to ensure all members operate within a robust, well-equipped environment. Shared resources and official materials, including letterheads for outreach to governmental and institutional partners, as well as contact lists, are being prepared to support unified and effective communication with all relevant stakeholders. The collective effort now moves toward engaging potential allies and consolidating collaborations across national and international levels. Please, unsubscribe if not interested. Next post is expected by next Friday, European time. A dedicated communications working group to coordinate both internal and external communications across all Beacon activities is being set. If interested in contributing, please contact the group mailing list, comms@health.int.eu.org. This group will be responsible for developing and maintaining the full communications infrastructure, keeping all members updated, ensuring clarity, coherence, and accessibility in all exchanges. It will also assist members and teams in managing updates, announcements, and media outputs, providing continuous support to keep all initiatives aligned and progressing efficiently. As for the soon-to-be-released new short film, it marks the beginning of a broad and transparent expansion across all COST countries, preparing new consortia, funded missions, and measurable results. It conveys our collective duty to advance education, health, and governance as one, to support those most in need first, with children's learning, well-being, and future as our highest priority. We will soon be sharing the finalized video. Below follows the text of the voiceover, soon to be read, heard, and seen with subtitles in full multimedia format. This is our call to action, important among the most essential of our time. The biosphere is failing, and with it, the foundations of life. Biodiversity loss, antimicrobial resistance, climate instability, famine, and social unrest are clinical manifestations of one disease: systemic neglect. Our duty is to intervene with reason and precision through education grounded in science and delivered through the best technological means made available to all. With rigor, expertise, and full commitment, we must ensure learning, equity, and prosperity, taking from despair to thriving all children, future leaders, from every background, prioritizing those most in need. Planetary evidence is conclusive. The rate of species extinction surpasses natural levels by over 1,000-fold. Coral reefs, amphibians, pollinators, and apex predators are vanishing together. Soils lose fertility, oceans acidify, and the atmosphere overheats. The self-regulating mechanisms of the biosphere are breaking down. Human survival now depends on restoring environmental homeostasis through coordinated, evidence-based education and governance. We now work within EU Beacon 1 health education via New Technologies Cost Action, a coordinated European framework under the Cooperation in Science and Technology program. COST sustains collaboration across more than 40 countries and welcomes participation from third nations committed to transparency, open science, and collective responsibility. The task is clear: to integrate human, animal, and environmental health education through advanced and open technologies. EU Beacon. One health education via new technologies. Cost Action coordinates education and research systems serving more than 1.5 billion people, including over 300 million children, whose health and future depend on timely intervention. Within 4 years, the action will deliver open courseware, digital infrastructures, and participatory teaching methods that connect science, policy, and governance. The goal is to establish a sustainable, measurable, and inclusive foundation for global One Health education, building capacity, strengthening institutions, and enabling prosperity. This is a coordinated clinical response to planetary disorder. The action's duty is to create and maintain an excellence network spanning continents, empowering experts and institutions to assist those most affected, including educators, researchers, and professionals operating at the front lines of environmental and health crises. By doing so, it advances careers, generates employment, and ensures that innovation serves recovery and stability. The symptoms of collapse are clear. Forests lose carbon balance. Oceans lose oxygen. Pathogens gain hosts. Conflicts and forced migration arise from scarcity. Pollution and ecological degradation amplify hostility, exploitation, and war. Hate and negligence are secondary infections of a sick planet, and these cannot be treated without restoring ecological and educational balance. Antimicrobial resistance continues to spread. Misuse of antibiotics, industrial waste, and weak surveillance allow microorganisms to evolve beyond therapeutic control. Hospitals, once centers of healing, now propagate resistant infections. Prevention depends on stewardship, wastewater management, vaccination, and genomic monitoring. Starvation remains a measurable pathology with devastating effects, direct and indirect, leading to conflict. Avoidable deaths? All. Misery, on a never-ending cycle of destruction, unless stopped. Over 45 million children face acute malnutrition, and more than 3 million die every year. In the cost area, over 30 million citizens live in food insecurity. Conflict, institutional breakdown, and disease increase the toll. Environmental degradation already causes over 13 million deaths annually. Within EU Beacon, One Health education via new technologies. Cost action, prevention replaces reaction. Surveillance, open data, and education form the operational protocol for restoring biospheric balance through coordinated science, pedagogy, and governance. Time is short, yet adaptation remains possible if action is immediate, equitable, and based on evidence. Humanity remains the only therapeutic agent capable of reversing decline. Humanity, at its best, lives long, in peace, and in health. Science and technology serve all equally. Education prevents decay and conflict before they arise, transforming ignorance into competence and despair into collective purpose. This is a call to act with precision and to repair the conditions that generate conflict, poverty, and neglect. Science and technology must remain open, freely accessible, and developed by the best to aid the most vulnerable within and beyond our professions. EU Beacon, One Health education, via new technologies. Cost action stands open to the best experts. Join this coordinated effort to lift institutions, strengthen systems, and guide a population of more than 1.5 billion people across over 40 countries, including hundreds of millions of children, towards sustainable recovery. It is a global action, systemic, preventive, and indispensable. Act with precision. Apply knowledge as treatment. Educate to prevent. Restore to prosper. The tools exist. The duty is ours. The time is now.